probably made that decision by the time I was 15 or 16. I had a wonderful primary care internist who was, to me, a mentor and a role model. And I always felt that if I could be half as good the doctor as he is, or he continues to be today, that I would have really done something great with my life. So it was an early decision. When I started practice back in 1988, I think it was a very different environment, and over the course of the last 10 to 15 years, the insurance industry has dramatically changed the way we practice medicine, and forcing us in a way to practice a high volume, low quality care, which is not what I got into medicine to do. And when I found that it was getting to the point where I was not able to provide the level of personal attention that I wanted my patients to receive, we developed the concept of HealthBridge, a center that would bring together a lot of different disciplines, both in medicine and in wellness, to develop something that was more kind of comprehensive, that really didn't deal with disease like putting out fires all the time, but more about prevention and keeping people healthy. And I think that model has grown now to the point where we have brought it into sort of the new generation of concierge medicine, where it becomes even more personalized, allowing more time and more attention for each individual patient. I've had the experience of bringing patients into our practice that had been in conventional primary care practices who felt that their needs were not being met, that they were not being listened to, that there were many unaddressed issues, partially due to time constraints, partially due to the difficulties in navigating the insurance system. When they come to us, we're able to often unravel those problems, really get down to the root issues, and help people kind of deal with what got them into these problems. So we're not just putting out fires with medications, and if their cholesterol is high, we don't just throw them on a medication. We want to understand why their cholesterol is high. We want them to work with a nutritionist. We want them to work with the personal trainers to lose weight. We want to try natural approaches before we just jump into medications. And often we find that we end up reducing the number of medications because patients often are being treated as a way to sort of move them in and out of the office quickly. It's much easier to write a prescription and send somebody home than it is to really spend time to get to the root of the problems, which is what we really want to do here at HealthBridge. We really take wellness seriously, and so much so that we have an entire division devoted specifically to what we call wellness activities. And these things include a full-time nutritionist who's available to our concierge patients as often as they want to come. We have an on-site private fitness training gym with personal trainers who are available to help both with planning a fitness program as well as one-on-one training. We have specialists in yoga, Reiki. We have a Qigong specialist. We have a massage therapist, an acupuncturist. So we have all the top level providers available at our fingertips to be able to help people find ways to manage their stress, their pain, issues such as weight loss, nutrition. We really look at wellness as a way to keep people healthy. Not only is our facility open 7 days a week and often until 8 o'clock at night, and we're open at 7 o'clock in the morning most weekdays, we have 24/7 access directly to the physicians via their cell phone and via email. So patients can reach us anytime they need, whether it be a weekend, an evening, a holiday. We're available, and most days the office will be open, so if there is a need, they're able to be seen right away.